Hello, everybody. Good afternoon. Let's go over some data, and then we will take some questions. No hospital deaths yesterday. That's good. Happy about that. I believe the state has updated nursing home deaths on their website. It looks like we did lose 2 individuals in a nursing home. Again, we don't have a lot of information as to was this over the last 24 hours? Was this not? Was this just a COVID-driven death, or did someone have COVID but had heart failure as well? We don't know enough about these, so we don't talk a lot about this because we just don't have the information. But certainly for those individuals, if we could just think about them and their family and grieve with them. Related to testing, so far there's been 25,893 tests that we've done. 24,601 tests have been returned. 502 tests returned since yesterday. There are now 1,649 positive cases. That's plus 35 from yesterday. And there has been 23,454 negative results. We sent 944 tests yesterday. We have 790 pending tests. 6.6% of the results we received have been positive. So remember, when we were doing asymptomatic testing or symptomatic testing only with some proactive testing, that infection rate was around 8. Now we're doing probably an 80-20 split, proactive testing to symptomatic testing. That's dropped down to 6.6. We've been doing this split for about a week. We anticipate that the infection numbers will continue to drop over the next few weeks. This week at the Syracuse Community Health Center, we will, again, any testing, universal testing, whether you're symptomatic or asymptomatic, come on by. It's a mobile drive-through site. And we continue to do certainly robust testing there. We talked about our mobile testing sites that we're doing. We're getting into neighborhoods, either neighborhoods where we might see some trends related to positive cases, or neighborhoods where we don't feel we have enough data related to testing coming from that part of that community. We're going this week on Thursday, May 21st. We will be doing testing at the Pastime Athletic Club parking lot, 1314 North Salina Street. And on Friday, May 22nd, we will be doing testing at Dr. Weeks Elementary School, 710 Hawley Ave. Both days the testing will occur from 9 a.m. to 5 p.m. Please go to the Health Department website at www.ongov.net for pre-registration. That way you can get a time, but it looks like anyone will be able to be tested at those sites as well. Again, over on our north side, high populations for our New American community. We want to get in there. We want to make sure that we get lots of opportunities for these individuals to get tested. Next week, we're going to go down to the southern towns, and I think the town of Lafayette will have more details next week on that, and we may try to get to the northern towns as well. Looking at our regional data related to testing, our mandate is on average 775 tests a day for Cayuga County, Cortland County, Madison County, Onondaga, and Oswego County. Right now, yesterday's number, we had another big day in Onondaga, 944 tests alone. Yesterday, with all of our partners, we had 1,390 tests. That moves our 7-day average for testing to 1,438, essentially almost double what is necessary. That's a lot of testing. So that's certainly good. part of this process, what's interesting, and hopefully I'll get some data points I'll be able to share, but we have, again, found pockets of asymptomatic folks that had some exposure to the virus, enough so that they will be positive on a test. So remember, when we were going into our assisted living facilities a couple weeks ago, we said we're finding asymptomatic individuals. We're starting to see that a little bit in some of these other properties where there's been proactive testing. So we'll continue to report on that. Hospitalizations, yesterday we talked about the number of individuals that no longer need to be hospitalized but can't test negative from COVID because we don't know how long you'll test positive with COVID. So there's a gap now with these folks going back to their residence and nursing homes. We've not solved that problem yet, so these numbers are inflated by about 12 individuals. But currently, counting those individuals in our hospital numbers, we have 70 individuals in the hospital. Give people a perspective on what that represents related to hospital capacity. That's why we track this, is to make sure there's enough hospital beds to treat sick people and get them better, not just for COVID, but everyone. 70 people represents 4% of our capacity in Onondaga County. 4. So certainly we want to get those folks back to their homes who don't need to be in the hospital, but related to hospital capacity, we're in excellent shape. And when you look at our critical condition, up a little bit from yesterday, we're at 19 folks now who are deemed critical. Again, a reminder, these are folks that essentially may or may not be on some sort of ventilator to help them breathe. I ask that we just think about them, these 19 neighbors of ours, because they are going through a tough time and we need them to get better. Looking at some demographic background on the folks in the hospital, 45 are Caucasian, 16 are African American, 7 are of another race, and 2 have declined to share their data. Why do we report this? Because there's been trends and narratives in other parts of the country how this virus impacts folks in certain demographics. So we try to share that information so that everybody has that information. Fortunately, this virus, for many reasons, has not impacted our minority communities the same way here in Onondaga County that it has in other parts of the country. To date, 199 people have been released from our hospitals. That's up 5 from yesterday. So looking at our numbers, 1,649 positive cases, that's up 35. Presently monitoring 707 active cases. 852 people have recovered. That's up 15 from yesterday, so that's a good number. 13 individuals in our positive case total are household contacts of previously confirmed cases. So this is a trend. Individuals test positive for COVID-19. Many of them don't have the ability to easily isolate from their families, whether or not you don't have many bathrooms in the house or whatnot. Are you taking care of children? How many people are living in the house? Other people become symptomatic of COVID-19 in the household. They then certainly count towards being positive COVID cases. 5 of the cases are related to affiliated with senior living facilities. Numbers down a lot from what we've been seeing. That's good. Why are we very happy about this? This is the demographic that has a much, much higher probability of going into the hospital, becoming an ICU patient, and potentially having worse things happen. So we're very happy to see those numbers start to come down from our nursing homes, our assisted living facilities. So when you look at the 35, we now have 17 folks in the last 24 hours from community spread. So I think we had 8 yesterday, 17 today, and I think we're trending about 13 to 14 on day for our new 7-day rolling average right now. So again, pretty good numbers, especially considering how We're now into restart. There's been more density. The weather's gotten nicer. I want to thank the public for taking this seriously, continuing to physical distance, wear masks to protect yourself, your family, and those around you. Looking at isolation and quarantine, 1,667 people in isolation and quarantine. And a lot of this is related to how long it now takes for recovery. 10 days, no symptoms or improving symptoms, 3 straight days, no temperature. Then anyone who is not a senior can be released from isolation. A quarantine is a 14-day period of time regardless. If you're a senior who's COVID positive, minimum 14 days. So these rules have changed mid-process here, so that's going to lead to higher active case numbers for longer and higher numbers in quarantine and isolation. Related to cases, 961 of our cases have been female, 688 male, 58 under 19, 259 in their 20s, 201 in their 30s, 205 in their 40s, 252 in their 50s, 222 in their 60s, 179 in their 70s, 172 in their 80s, 101 in their 90s. Percentage by breakdown, 19% under 30, 31% under 40, 44% under 50, 59% under 60, 41% over 60 years of age. Breakdown by municipality, City of Syracuse, 884 total cases, 387 recoveries. Clay, 125 total cases, 93 recoveries. Onondaga, 123 total cases, 34 recoveries. Geddes, 89 total cases, 29 recoveries. Salina, 74 total cases, 48 recoveries. Manlius, 64 total cases, 54 recoveries. DeWitt, 62 total cases, 52 recoveries. Cicero, 57 total cases, 33 recoveries. Camillus, 54 total cases, 34 recoveries. Lysander, 31 total cases, 26 recoveries. Pompey, 24 total cases, 21 recoveries. Van Buren, 22 total cases, 6 recoveries. Skaneateles has had 15 cases and 15 recoveries. Marcellus, 7 cases, 4 recoveries. Lafayette, 5 cases, 3 recoveries. Atisco, 5 cases and 5 recoveries. And the towns of Elbridge, Fabius, Spafford, and Tully all have had 2 cases and 2 recoveries. Related to restart, I know there's been questions about questions about what phase you're in. We now have our economic development team. I believe we have this poster here, www.ongoved.com. If you go there, you can. There's going to be an email for questions related to businesses reopening. And then there is an email for questions related to complaints related to businesses that you believe are illegally operating. There is also a phone number for complaints about businesses that may be illegally operating. That number is 315-435-2210. So both at this website, if you have questions and you're a business about phases where you may land, you can email us those questions. And if you have a complaint about a business operating, we no longer want you calling 911 about that. We'd rather have you go to this website, fill out a complaint form, or call 315-435-2210. We're going to open up Oneida Shores Lake for Memorial Day weekend. We will probably have some sort of walkthrough for the media on what that will look like, how we will do that in physical distance. Before then, Jamesville will not be open for Memorial Weekend, but we will be opening up Jamesville Beach in the coming weeks. We are working right now on a potential opening for the zoo. I will have a date for you for the zoo tomorrow and what that will look like, and I will also give details on what curbside pickup will look like related to our libraries tomorrow as well. Childcare Solutions, as we get into the phases, we are going to extend our Childcare Solutions program for our essential employees through the month of June. So daycare is a challenge for folks. We still have daycare slots available. If you need daycare, 315-446-1220. Again, we are extending this program free of charge to essential employees that have daycare gaps that need help. So I know that's a big concern. Through the month of June helps get us through that period of time where there may be gaps with kids being home and now when they were normally in school. But after that, and certainly we are working with guidance on summer camps and how that's going to work with our state partners and our health department. But we anticipate that there will be summer camps later on in the summer. Other questions?
Obviously, it's looking like it's going to be a nice weekend here in central New York. The governor gave some guidelines about what, mini parades and other celebrations were acceptable, but he kind of punted to local governments to decide what it will look like in their counties. How do you see Memorial Day being recognized here?
Yeah, unfortunately, and again, Memorial Day is something that we really cherish in Onondaga County. And we have called off our ceremony at the Veterans Center, or Veterans Cemetery, excuse me, and many other parades and or ceremonies have been canceled. And so it's kind of, that decision's already been made, really. So essentially 10 people together remembering those who have sacrificed the ultimate price for our communities and our country, appropriate. And I heard the governor talk about if there wanted to be a car parade or whatnot. It's kind of too late for planning with that in this. So this is going to be a year where I think individually as a community, we need to remember why we have Memorial Day weekend and the sacrifice that so many have given all of us so that we can be here and experience the freedoms that we have a newfound respect for, because many of these freedoms have been limited over the last 75, 80 days.
Has the pandemic had to change any of the policies at the Veterans Cemetery in terms of what's placed there? I think people are looking for the flags and haven't seen them yet. Any insight you can give us?
Yeah, I'll get some more specific questions. I think that's an important one, Andrew, that we'll get you that information about. But certainly related to, we have some construction going on out at our Veterans Cemetery right now. I was there over the weekend. But specifically to how we want people to be able to go and remember and with their loved ones and honor them. But certainly we're in this position here where you have to try to figure out safe ways to do things, and what's safe is debatable by various points of view. So again, this is one of those situations where you're putting the airplane together in the air, and so we're going to use common sense with our guidance and ask everybody to use theirs as well. But we'll get you guidance related to leaving and putting flags, flowers, everything there, so that the public knows about that going into the weekend.
The county has historically put flags out. Will that happen again this year?
We'll look into that. I'm not exactly sure.
It's nice out right now, and it's going to be nice going into this first holiday weekend since we've been in this pandemic, this uncharted territory. Can you talk a little bit more about any concerns you might have, what you want people to know as they're making their plans or they're stepping out, right after this?
Yeah, I mean, it's a great week of weather. So we will learn more about this virus, how it performs with more people, but in different conditions now. The traditional flu doesn't perform as well in these types of conditions. So we're going to learn how COVID-19 really behaves in warm, sunny weather at this time of year. But we need people to continue to physically distance. We know enough about the virus that if you're far enough apart, it's very difficult for it to latch onto you. So that's going to need to be important. I know things will be busier. Farmers markets will be busier. We saw how busy the farmers market was this week. Dr. Gupta and her team have spent some time over there with the teams there at the market about ways they can do things better moving forward related to physical distancing with communication and procedures. And that's kind of how we're going to have to do this when we see areas where people are getting together, and there's I'm not saying it wasn't safe, but certainly improvement could be made there. But it's tough. We got to live, but we got to be smart. And if we can be smart, there's no reason when you're at the farmer's market not to be wearing a mask, right? You know you're going to be within 6 feet of somebody during that process for a period of time. If you're not concerned about yourself, somebody else is concerned about themselves. So I would just ask you to do it as a neighborly thing, and at the same time, it will benefit your own personal health as well.
We got some complaints about the farmers market this past weekend. Did your office get similar complaints, and is that why Dr. Gupta made time to meet with them? Is that a recent development?
Yeah, we get complaints all the time about stores or events. The market's run by a state authority. A lot of people don't differentiate who we are and who's in charge of what. So
it's your fault, Ryan.
So you're 100% right. Most things are, and so we had to deal with that, and we're very happy to help any team. That's what our local health department's here in this time. There are experts in this field, in this space, to give guidance on how we can protect ourselves and our families and our neighbors. So we got a lot of complaints. There's a lot of pictures taken. There's never pictures taken of people doing the right thing, only when people are doing the wrong thing, and not intentionally. If you're in a busy area, it's not that anybody's trying to do anything wrong. They're just trying to get food and enjoy the day. But there's ways that you can do things through traffic, different traffic patterns, as a business, and that's what the market is, to help keep your consumers safer. And so that's kind of some of the guidance our health department helped them with.
I'm just looking for the timing, though. Was it this weekend specifically that spurred that health department farmers market conversation?
Correct.
Going back to the data, the community spread numbers, it seems like that number has doubled. Can you explain why?
No, our average is actually right where it was last week. So we don't ever look at one day. We look at a 7-day average. I think for the last month we've been between 19 a day and 11 a day. And so I think yesterday we had 8. So yeah, technically from yesterday it doubled. But it's really when these essentially the lag time of when they come in through a 24-hour period. And remember now, we're doing so much testing that some of these community spread numbers may be asymptomatic individuals too, because our symptomatic testing is down so much that a lot of the results, if they're senior driven, essentially right now New York State's doing that testing, and if they're household contacts, these are people that have gotten sick with COVID-related illness in a household of the COVID positive, so they're deemed COVID right then and there. So when you look at it like that, our percentages of those who are tested who are COVID positive are even less than the 6.6%. So we're still comfortable. 18 is a good number. We're in day 4 or 5 of restart. If that number was higher, we'd still be comfortable. But the one way we can get this process moving forward, and the one way that people can help us with hospitalization rates, is to continue to physical distance. Because if you get COVID and you're younger, you're probably not going to be in the hospital. But if one of your contacts is a senior or somebody who has a medical condition, they could end up being in a hospital. And then if you're in a hospital, you're one step closer to being in the ICU, which is where we don't want anyone. So this is all about managing risk and staying away from each other where we can, wearing a mask when we're going to be within 6 feet.
Are you or is the health department in this county aware of any cases suspected or related to COVID-19 in kids? Any kids being admitted to Golisano Children's Hospital that you know of, or anything for something related to this?
Yeah, with the new virus that they are seeing in downstate, we have not seen that here yet, if that's specifically what you're referencing. There are kids who have gotten COVID-19 related to essentially contacts, household contacts, and we have our 19 and under number. Most of those are probably between 17 and 19 years old, but we do have cases where there are children who do have COVID-19, but not this new rare disease that some think is affiliated with COVID. These children have COVID-19.
Have any high schools taken up the offer for NBT Bank Stadium or the amphitheater to hold graduation?
Yeah, so our team is doing a lot of work right now with many of these high schools, looking at their plans that they have. Some of the smaller ones will probably do something on their own campus. Some of the larger ones are probably looking to do something a little different, and they are looking at all of the venues we've talked about, whether it's the Parkway, whether it's the MBT Bank, whether it's the amphitheater. Certainly some of them are more affordable than others. So our health department is actively involved with looking at this. Again, these graduations should fall around phase 4, right, where mass gatherings aren't an issue. But the smaller ones aren't really mass gatherings potentially. So we're spending a lot of time with the superintendents and trying to do something where these seniors can have a good memory leaving high school.
How much does that cost the school district?
It's different. So the Parkway costs are limited. I think you're looking at MBT Bank Stadium, somewhere between $4,000 to $7,000. The amphitheater only becomes viable if there's going to be more than one high school doing it, because for us to put on one show, it's going to cost us a certain dollar amount, no matter what, whether we put on 1 or 20. So again, we're not in a position to do these things for free. We have a $100 million budget gap.
You mentioned children and you mentioned summer camps. We know some organizations locally are already planning them. Are they in touch with you? Is the county willing to give them guidance in their planning?
We think there's going to be some state guidance coming out related to this, and then certainly if there's gaps, you have state guidance which gives you this kind of broad range of rules, and then you have to really plug in the local element to that. There might be something that's not covered in the state guidance, and then our local health department and our office will give guidance on that. So we anticipate that to come out, in the next week or two here.
Yesterday, once all the numbers were added up by the end of the day, there were more than 100 deaths. We hit that tragic milestone in Onondaga County. What does that milestone mean to you? It was not long ago we were looking at other counties thinking, wow, 100 seems unbelievable, and now this county's in the same position.
Yeah, the loss of life is just painful. And that's what it is. Whether you have 1 or 100 or 1,000, somebody's lost a loved one sooner than they would have, right? When you look at it from what the numbers mean compared to others, our percentages are actually pretty good. But it doesn't change the fact that we've lost 102 people, I think, and before they should have died. Some of these folks were very sick to begin with, but COVID-19 stole time, and time is certainly all of our greatest asset.
Going off the announcement yesterday that it is in fact Amazon that's going to be who's in that big warehouse in Clay. It's been reported that there is going to be $28 million in tax revenue, and that will go to the school district, the town of Clay, and the county. Are there any specific ideas in the works for that, things that your team is coming up with?
Yeah, I think so. Those are the pilot payments over the period of 15 years. I mean, we only have discretion over what we receive. But certainly that will help offset. Every year in government, remember, it's very people-driven. Your employees are probably 80% to 85% of your costs. So you have bargaining unit contracts, right? Your sheriff deputies, your police officers want to get paid, they want to get a raise. Your health department employees, all your bargaining units, they want to get raises each year. So you negotiate that. And so you have a cost of just operation, just like any other business that increases every year. So certainly that's new money, and certainly we'll look at the 2021 budget, incorporating that new money in, and that will provide us with flexibility that we didn't have in 2020 as we put our budget forward to the legislature later this year. But what we would do with it, at this point, we don't know enough about where we are fiscally right now to figure out if we do anything else other than help minimize the pain that we're going through right now.
What are some of the modifications to Oneida Shores?
Yeah, so the capacity is gonna be limited. We're gonna have things set up in a way, and again, we'll probably invite you out there to take a look at it because I think it's gonna be interesting. We're gonna have essentially areas marked off for families. One of the nice things about Oneida Shores is how do you control the capacity? You control it because if you've ever been there, you got to pay to get through the gatekeeper. And then you can easily communicate how many people are on the beach with the gatekeeper. And so that's a easy facility for us to be able to control the physical distancing, because then we're going to control the areas where people can sit as a family, and then there will be clear communication as to areas where folks, if they're going from the water back to the beach, where they walk and whatnot. So we'll have everybody out, and you guys can all go. I'm not suggesting you can go on the beach on the job, but you can see the beach because it will certainly be nice later on this week before it's beach time this weekend.
Have you met with the regional partners today, and if so, what did you discuss or decide?
We did. Had a discussion. We talked about my concern related to the individuals that shouldn't be in the hospital from nursing homes having to test negative before they get sent back to their homes. That could take months, right? We don't know enough about that. We could test those folks every day and get a positive every day for months. So these inflate your numbers when you're monitoring hospitalizations each day. So that's a concern. That's something we have to work out with the state. We encourage that metric needs to change. Those people can't count in our hospitalization numbers. And then we talked about, again, recommendations that we're seeing at the local level that we're comfortable with changing that isn't clear yet. Religious institutions. Right now, you have the ability where we have some very large churches. Hundreds of people come together Sunday. Certainly at this point, that's a public health risk. But we are comfortable being Onondaga County in phase 2, allowing 25% of the capacity for religious services in the buildings. Then you can go a little bit higher in phase 3, and then phase 4 you go full blown. So we talked about that being something that we're comfortable with. We're on the ground, we see this, we're comfortable with that. And then it's just a nice clearinghouse where other small questions from other counties can get their, just communication back and forth. So, there's not a lot of, I know that some people are interested in listening into it. The state will give discretion on whether or not that's allowed or not, but certainly it's a process where we give an update on the data to the region. We then have questions answered that we asked the day before, most of them related to restart, and then we give feedback and ideas, and then they run those ideas up to various decision makers.
The number and email address next year, that's for both businesses proactively asking if they fit and complaints from everyone.
Correct.
Have you gotten any phase 1 specific complaints out of the ordinary of your normal complaints?
I don't think so. We received, well, one. I think we talked about that. One establishment on the north side. But outside of that, I think we've been pretty good related to complaints about businesses. We do get complaints about businesses wearing masks. That's something that we're going to take very seriously, especially restaurants, back of the house, front of the house. Just do it. It's common sense. Please do it. I hear about it every time someone orders a pizza and someone's not wearing a mask. They email me, and we need you to be smart. Please, just if they're working, have your folks wearing a mask. Make our job a little bit easier as a community to get through this.
Do you have masks for those businesses?
We do. If people need masks, we still have masks available, and we'll get them out. Isabel Harris is in charge of our mask committee. She's been doing a great job with that. So Isabel will be more than happy to get masks to any business that needs masks for their employees.
Today, the governor announced that St. Joe's is one of a handful of hospitals that will start allowing visitors. Were you involved in that decision at all?
No. I'm happy that somebody in one of the hospitals in our region are to test that. And it's important that you try these things, similar to what we were talking about with religious institutions, bring capacity up a little bit, test it, see what happens, see what we learn. But I was happy to see that that happened, and I think it's smart.
I guess, what can you say to people in this community who you've said have done such a good job sticking with this social distancing, especially as we head into and continue this nice weather week? What can you tell them about the best case scenario if we just all keep doing this?
Yeah, we will look very good if our numbers in restart look the same as the week before restart related to positive cases. That will be, very impressive for the community at large. And then if it happens again after phase 2, I think that then tells us a couple things. One, our community is learned how to live with this virus, but also maybe this virus is weakening a little bit. But we need to continue to, we don't know that yet. We're still learning about the virus. We're still learning about how restarts are going in other parts of the country. So what we do know is what works and what has worked for us, and we just need people to continue to double down on what they've been doing by protecting themselves and their family from this virus. And for most of us, it's a really, really, really bad flu. But for people we love that could get this, it can be much, much worse.
When you mentioned mobile testing sites in areas with a lot of new Americans, do you have any reason to think that there might be an outbreak among new Americans?
What we're doing, there's no reason to think there's an outbreak. We've had cases in the new American community, certainly, but nothing to suggest that there's a problem. But because you're talking about a community that speaks many languages and has various leaders, it's easier for us to bring the mobile lab to their neighborhood than it is maybe to get those individuals to come to the Syracuse Community Health Center. So we know that, and so that becomes part of our proactive strategy.
I know we talked about this before, but talking about contact tracing, I know you cross-trained a lot of people. Can you explain how some people in the county have done similar things and who those contact tracers are that you train? Sure.
So right now there's a partnership with the state. There's a digital platform that we're working through. It helps feed new cases into the platform. Our contact tracers and our health department then go in and start working on those. In addition to that, we have not had to implement these individuals yet, but we have contact tracers in our adult and long-term care department, our children and family services department, probation department, my office, and I believe there's a couple other departments as well who have taken an online course by Johns Hopkins, Dr. Gupta's alma mater, and they are now they have now graduated from the course. So it'll be interesting to see if they put that on their resumes moving forward. But we have not had to utilize those cross-trained departments yet with the flow yet. But this is actually today, I believe, is really the first day that this digital platform, this partnership with this platform with the state health department and the local health departments, I believe, is up and running today. And Onondaga County and our health department is one of the first communities to get it and to work through it because of how respected the health department is. Other questions? No? Okay, well, normally we would be in May at a luncheon, usually at Drumlin's, to celebrate Older Americans Month. And we have had so many of our seniors contribute so much to our community over the years. And it's a great luncheon. We have numerous awards. We're going to send out a press release on backgrounds on all these individuals and all the contributions they've made to our community. But I just wanted to announce our 2020 honorees. Our co-senior citizens of the year are Joseph Godley and Marvin Chandler. Again, in the release, it will talk more about these individuals. Our serving seniors honoree of the year, Ruby Gilbert. And our Flanders Memorial Caregiver of the Year is Amanda Tiroli. So I want to certainly thank our honorees for their service to our community. And again, this is Memorial Day weekend, and Memorial Day, we can't be together the way we normally are, but we still need to remember more than ever, because many of the folks in our community who have taken the liberties we have for granted have had a small taste of what these liberties, when they're limited, feels like, and it's tough, and it's hurting us economically, from a public health standpoint and a mental health standpoint. So let's remember those who have paid the ultimate sacrifice, not just on one day this weekend, but every day leading up to it, as a way that we can really give tribute to their amazing sacrifice and remember their families, our Gold Star mothers, throughout the week, not just over the weekend. So everybody continue to stay strong and be safe.